Hi, welcome back to Rorik Knows Podcast, helping you become a better and more informed you. I'm Rod Rorik. I'm a board-certified plastic surgeon in Dallas, Texas, and we talk about what's new, what's helpful, and what's on the horizon. And this is an incredible new horizon in post-op care, but also in facilitating skin care, nourishment, and it's a new revolution. It's called a CO2 mask. And of course, I have the founder and CEO, Lana Kerr, here. So tell us a little bit about the CO2 mask and how it's really changed you and what you do. Look at her skin. She looks amazing.
Thanks.
I think a lot of it's her genetics, too.
No. It's the CO2.
It's the CO2. Oh.
It's the CO2.
Do you do it every day?
I do it once a week.
Once a week?
I do it once a week. And because I have vitiligo, I can't really do any other energy-based devices. In the last 2 years, once a week. Before that, it was twice a month.
Twice a month. Wow.
Yeah.
Okay. All right. So tell us about the mask and then all of its innovations. She's an incredible innovator, and she really, really thinks outside the box, and I love that. And it's really helped all of us in plastic surgery and dermatology.
Yes. So the CO2 Lift is the first gel delivery system for carbon dioxide. When you mix these two packets together, it creates carbon dioxide, which when you put it on the skin, it elicits a response from the body where oxygen is now rushed into the area because there's an affinity of hemoglobin for picking up the CO2 and unloading the oxygen. So it has been compared to a topical hyperbaric oxygen chamber.
Right.
That's what it has been compared to.
Right, and it's really scientifically called the Bohr effect. Look it up on AI. It really hypersaturates oxygen in that area, which then provides for hydration, nutrition, and all kinds of incredible metabolic changes in the skin that are really phenomenal.
Yeah.
So, and I know we've been using it a lot in post-op recovery, enhancing post-op recovery for fillers, neuromodulators, also energy devices, and of course facelifts and body contouring. So it's really been revolutionizing post-op recovery, and really that's the game changer in today's way that we approach cosmetic medicine. It should be seamless, it should be safe, it should be very, very powerful and useful and science-based, the three S's. So tell us about what are some other innovative uses that you've really, I think, pioneered?
The CO2 Lift V is something that came about from my own needs. You know, when a lot of things that I get passionate about come about because it benefits me personally.
Okay.
And I'm going to be 54 in another month. And when I was in my mid to late 40s, I started experiencing changes in the quality of intimacy, the way I enjoyed sex.
Yeah.
And so I educated myself on what happens to that area because, you know, when we think of aging, we just really think of just the face and the neck, but it affects everywhere and our intimate skin. So some of the changes that happen, you know, thinner, drier vaginal tissue, because that tissue has been compared to the skin under our eyes, very thin, shows age first. Our vaginal tissue is just like that. It gets thin, dry. Then the clitoris, which requires blood flow to operate optimally, starts slowing down from the age of 25. So then by your mid-40s, if nothing was done, that clitoris can atrophy, which affects sensitivity and pleasure. So when I got to understand that, I approached one of our medical advisors and I said, what do you think about using the CO2 Lift there? Because we are doing that. We can blood flow. So, and what really triggered my thought for that is we had just completed a diabetic wound healing study. Right. And the problem with diabetics is circulation, right? On their extremities. So I'm like, if we can close a non-healing wound in 8 days because of blood flow, what can we do there? So we did our first pilot double-blind study for that area, and we were really surprised. So the women that received the ultrasound gel showed no change in sexual function. The women that got the CO2 Lift, and we didn't have the V at the time, it was just the CO2 Lift Pro. They showed significant changes in all areas, in lubrication, in orgasm and sensitivity, in bladder life. And the women that, and then we did the biopsies, and that tissue that these women it was just old tissue. It looked like they were in their 30s. So that got me very excited. No pun on the word excitement. I used it myself, and I was like, oh my goodness. So I gave some to my mom and my aunts, and they went from sandpaper to butter.
Really?
So I was really excited about that. So we then said, okay, we need to develop an area for this. We did actually a study with New Beauty to see how women would feel about the CO2 Lift Pro using it down there.
Right.
But we didn't get a good response. Women felt like, oh, they wouldn't want to use the same thing on their lips here that they're using on their lips there. So we said, okay, and then we had to think about pH because that's another factor. So we actually created a different formulation for that area and then a way to apply it. So we had to have an applicator that goes in similar to a tampon. But we have seen incredible results, Rod. I mean, we have thousands of testimonials from women, not only my age who are menopause, in menopause, but women from in their 30s, just an improvement in the quality of their sexual life, as well as even there's some doctors here, gynecologists, that are using it to help women get pregnant. That have a hard time getting pregnant, they give it to them. We have no clinicals on that. It's hard to do that, would be hard to do that, but just the results that they're seeing is incredible. And you think about it, just oxygen, blood flow, life is in oxygen, all of that down there. We're helping with lichen sclerosis, so really all the conditions. And then of course there's an application in surgery for healing as well. After labiaplasties, you're using that, women recover very nicely. Vaginoplasty. So yes, we have another application that I'm very, very proud of. I feel that is really helping women to just up their game, especially I think at this age of our lives. I mean, we have surgery, so we have things that we can do to look young. Right. But what about there? What about this part of our life? As we get to be more mature, more experienced, we are affected this way.
Right.
We can do something about it, and that's what we're doing. So we're trying to normalize the conversation. I'm so glad you're talking about this with me. But this is something, is a need. Women need to know about it. It's non-hormonal, so for women who are afraid to take hormones, this is a great option for them. It's something, the protocol, they would do 10 treatments within 2 weeks. There's no pain involved. It's a very pleasurable experience.
So you basically, it's 10 treatments and it's applied similar to it's in a tampon based. You mix the two together and then it's 45 minutes? Or?
Well, you sleep with it. You can leave it on 45 minutes, but it's easy just to go to bed with it.
Okay.
Wake up in the morning, you pee it out in the toilet, you're good to go. There's no downtime. So after 10 treatments, then you just do one a month to maintain that. But women are really seeing a result within the first 3. Your partner will see a result. So it's not only the functionality, which is what really, to me, is important, but the cherry on top is how it looks, too. It just gives it a nice, aesthetically appealing look, too, because aging, again, that affects there, too.
Yeah, that's amazing.
Yeah.
That's brilliant. And I think, I actually have used it in several of my labiaplasties, and it really is because, after labiaplasty, there's all these fresh wound edges, and it really makes it so much more seamless. They say, wow, I really like it, and they've transitioned, because I've told them about what you've talked about and looked at some of the science. So what about the flip side? What about for the males?
Oh my gosh, I'm glad you mentioned that.
What about the males?
We can't leave out our men.
Are they supposed to apply it?
Well, I always tell men.
We want to keep this very, science, PG.
Yes, of
but
course.
What about the males?
Well, I mean, men, this is something that many doctors are using for men, not the V, because hopefully...
It's called the P?
That's what we need to call it, right? We need to call it the P. The P. I guess CO2 Lift Pro, the P in the Pro goes for P of the penis too. But, but yeah, it's been shown after 5 treatments to improve the SHIM score, which is a sexual health index for men, 5 to 12 points.
So you've done this, yeah?
Yes, we have
awesome.
some studies on that, and it's been amazing for them. I mean, more sensitivity, again, longer erections. Again, it's blood flow, and blood flow is so important for all of us, for all areas of our body. So yes, we have that application, and it's used everywhere, not only, the front, the back, everywhere.
So the V can use by males?
The V, well, the V can be, but hopefully most males, the one packet won't fit them. Hopefully that's the case.
Okay.
So we like to, for men, they use the Pro.
The Pro,
yes.
Okay, good.
But the applicator, some men use it because it can be used for hemorrhoids. So they use that applicator if you're going to do anything.
Wow.
Yeah.
That's awesome. That's awesome. Wow. I've learned something today. So tell me, so what are some take-home points for the consumer that says, wow, I really love this, so I want to try it, I want to engage in it, so how do they find out about, how do they actually get the CO2 V? Yeah.
So like the CO2 Lift Pro, the CO2 Lift V is available with their physicians, or they can get it on our site.
Yeah.
The takeaways that I think for women, most women are concerned with infections. They're thinking, if I use something down there, will I get an infection? No, the pH is perfectly balanced for women. In fact, women are getting less infections by using the CO2 Lift V. It keeps it balanced. Women who are seeing, even with periods in their menstrual cycles, just better flow of their menstrual cycles, less pain in their menstrual cycles. So the CO2 Lift V is safe, so women can feel comfortable about that. There's really no contraindications for that. It's something that's simple. You control it. You can, as I said, you insert it. You're going to bed. You're going to sleep anyway. After you're ready to, you insert it. You're good to go. And I think another good point is that for women, we are very cerebral individuals. I always say, our biggest sex organ is our brain, and we have very few sexual cues as women. So the act of taking care of that area kind of brings it top of mind. We're expecting it to be comfortable. So women this will change your relationship, women.
Wow.
Yes.
Cerebral. Women are cerebral. Yes. I don't know about males, but women definitely are cerebral. Wow. Lana, that's phenomenal. Thank you so much. So, safe, simple, powerful. It's amazing. This is truly transformational. So, if you like this, obviously join us when I talk to Lana about the CO2 lift on the face and its powerful, effective use in wound healing and in nurturing the skin and making it look youthful and natural. So give me your thoughts and comments, and thank you for tuning in to Rorik Noah's podcast. Until next time, stay informed and stay well educated.